可以繼續嚇，就
Let's continue. It's always good to have a break, and we can all reflect upon on what we have missed. Mr. LINN would like to ask a few more questions. This is how I think about it. It's somewhat extraordinary that the Department of Health's views were ignored. I was asking questions about Appendix D, 2 pages of Appendix D. From the Deputy Director of Planning, we have learned that the relevant planning code stipulates that the HA views should be attached more importance. HA manages public hospitals. Why is it that the Department of Health was not considered as the authority and not the HA? I think compared with HA, the DH role was more relevant in respect of a private hospital. Deputy Director? Well, the information I provided is clearly written in the Hong Kong Planning and Standard and Guidelines. And that was set down by the departments and relevant authorities. So you did consult the Department of Health as well? Yes. 5.5 beds per 1,000 population, public and private hospitals taken together. Mr. LINN. I think the Deputy Director of Planning is the most experienced one among those seated here. Turning to Appendix D. All along, the DH, in respect of using the remaining portion of land for residential development, had expressed reservation. I've invited the witnesses to examine the entire process. Starting from April 2000, there was one occasion when it was consulted. Again, June 2000, August 2000, December 2000. Was it normal or not, Deputy Director? Well, when every step was taken in the process, we would consult the relevant departments. But you asked them once every 2 months. Well, there were different procedures involved back then. December 1996, that was a Section 16 application. We consulted the department. November 1999, another application, and that is the one involving providing 200 more beds. And in April 2000, the operator wanted to ask for a review of the application rejected in November 1999. But actually the review was subsequently withdrawn. And then in June 2000, they submitted a rezoning application. And for every process involved, we consulted the departments. In August 2000, that is after the rezoning, we also received objections. And again, we sought the views of the relevant departments. And December 2000 and March 2001, there were further objections. As I've explained, the Town Planning Board would hear the objections, and the land use was changed from residential to GIC. But then there were further objections. This time, the operator submitted further views to the Town Planning Board, and we received further objections. And again, we consulted the departments again. So every step of the way, we would consult the relevant departments. What the impression I get seems to suggest that you kept asking the Department of Health until they offer no more comment. That's how I look at it objectively. You would keep asking them until they reply that they have no more comments. Maybe the Deputy Director can help us consider my way of thinking. I asked whether Mr. C.H. Tong's housing target of 85,000 units had anything to do with these questions which were asked at close intervals. The Deputy Director didn't give a direct reply. It was said that in 1999 and 2000 there was an acute demand for more housing units, things like that. As for this application for change of land use, did the Town Planning Board handle many similar applications at that time? Because there was a need to do things to tie in with the housing target.
So 3 questions. Was it that the DH was asked repeatedly until it had no more comments to offer, and then 85,000? No, no. It was not that we kept asking till they said they had no comments. In fact, apart from asking the DH, we also asked other relevant departments for their input. Every time we receive applications, including rezoning applications, objections, we circulate them to relevant departments for comments. And in fact, every time an application comes, the nature is different, and so every time there is a fresh round of circulation. That's our practice. And then 85,000 flats. I didn't see this in any of the papers. So if this target is no longer mentioned, it no longer exists, right? And as I did not or have not researched into this, I can't really give you the information and the papers. Mr. Chairman, I really hope that we can get hold of more objective evidence to help our internal deliberations. So I hope that the witnesses present today can provide us with the relevant papers if they can, because I really have this impression looking at the chronology of events. And can I ask the DD whether she can provide the following: the year 2000, 2001, and also 2002. In other words, when G applied for rezoning, whether the Town Planning Board during that period handled similar applications for rezoning to residential use. Can you give us the number for our reference? Yes. Concerning all the rezoning applications received, similar rezoning applications from 1999 till 2002. We can give the numbers to members. Right, do the directors of bureaus and heads of departments have anything to add? No. Mr. Kenneth Leung, do you have any follow-up questions? No. Right. I think I will now hand the chair back to Mr. Abraham Sheck. So I will now move on to section or part 5. Mr. Alan Leung, I believe you'll be glad to hear that as the member responsible for Chapter 4, I think many of the issues raised in Part 5 have already been dealt with. But finally, I want to ask this question. The two directors of Bureau and the Director of Lands have told us that they have learned from experience, and with regard to land grants or land sale to profit-making private hospitals and non-profit-making private hospitals, a new mindset will come in. So can I ask either Mr. Chen or Mr. Koh whether they do have a timetable with regard to the problems appearing in Chapter 4 of this report. When do you think we'll be able to deal with and resolve all such problems? Mr. Koh. Now, with regard to the accounts of the hospitals, their surpluses, now, of course, we've received such information, but we have to analyze the information, and we may need to seek legal advice and the advice of relevant departments, and this process is going to take some time. But we'll act as soon as possible. In fact, we've done the things that we can do. For example, under the existing policy, 2 sites have been reserved for hospital use and ancillary facilities. And when these grants are still valid, no change of use will be allowed. So this measure has already taken effect. But then concerning the more complex problems, it may take us 2 to 3 years. And then concerning the 2 salient requirements, Chairman, provision of free or low charge beds, when do you think you'll be able to resolve that issue? Now, sorry for being a bit long-winded. Not the private hospitals need to provide these beds, but it's not enough for us to ensure that these beds are provided. We also need to ensure that these beds are properly utilized. And so I think we will need 6 months to 1 year. Alan, all right, 6 months to 1 year. So the Secretary is of the view that suitable arrangements will have been in place after a year. So we'll put this on record. And then may I refer to para 5.4. And I read from that, for existing private hospitals on PTG sites, EXCO approved that the government will endeavour to replace the special condition for provision of low-price, low-charge beds and include it in the land leases of existing non-profit-making hospitals by the minimum requirement for provision of standard beds at packaged charges. So is this an ongoing task? Mr. Cole. In fact, this policy is reflected in the 2 hospital sites being tendered. But then there are still 11 existing private hospitals. So you mentioned 1 year. Do you think you will be able to resolve this issue within a year's time? Well, for low-charge, low-priced beds, I mentioned 1 year. But then this one is related to the transparency of charges. So it's a slightly different issue. Fee transparency is one issue. 20% low-priced or low-charge beds is another issue. So concerning packaged charges, I would have to talk to the hospitals, urging them to continuously make charges more transparent. So you don't know when or how long this will take, but will you set for yourself a target date or a target timetable? Secretary. In fact, we said that some private hospitals were already providing service at packaged charges. It's difficult for us to set a date because we have made it quite clear that packaged charges cannot apply to all hospital services. Package charges can only apply to services like obstetric service. So I cannot really give you a date. But then for new hospitals, we require 30%, and they must be able to satisfy this requirement. Concerning 5.4. It is said that EXCO has already given approval on this, but then there are already existing grants. Can the EXCO change the terms of or the conditions of the grant? So do you agree with what is said in para 5.4 or not? Because the spirit of the contract is very important. These are existing grants. They can't be changed arbitrarily or unilaterally. So is it lawful for EXCO to change the grants arbitrarily? That is why I'm saying, Chairman, that these are 2 separate matters. Now concerning bidders for the new hospital sites, they are aware of the new tendering conditions. But then for existing hospitals, of course, we can't apply the new policy to the existing hospitals. But you're saying that you accept the recommendation, so perhaps the Director of Lands can explain. So when the grants are up for renewal, but they won't be up for renewal till 2047. Now, in the interim, I can only say that I support the principle, but because of the spirit of the contract, I can't change any part of the grant. But then you said you agreed with the Director of Audit. I'm just trying to give you an opportunity to clarify your position. I want to clarify that I agree that in future I should use this means and not the means of setting a percentage. But then for existing hospitals, I cannot change the content of the contract. But when the EXCO approve the new policy, and I don't think you can override EXCO, right? So, Director of Audit, can you elaborate on 5.4? The Chairman, the EXCO's decision represents a policy direction or a policy intention. But as to how this policy intention is to be implemented is for the administration to decide.
And even EXCO has to comply with the spirit of the contract. But here it seems that it's an order. You have to change the lease. Director of Lands, you are the enforcement agency. Can you explain how or whether this can be done? As I said last time, apart from renewal, which presents itself an opportunity, in the future, the grantee may want to ask for different types of lease modifications. Some may be proposed on technical grounds. In the future, we would see such opportunities with the relevant department to see whether we can reintroduce the conditions which the policy bureaus thought fit. So even if we are to do this, we'll do it through legal means. Thank you for your confirmation. It's not that the government can do whatever it can. That's very clear. Alan, sorry for that. Don't mention it. They are just endeavoring to do this. Of course, it must be something that they both agree. And then turning to the recommendations in J, the way forward, periodically assess the effectiveness of the stepped-up enforcement measures taken on existing private hospitals and PTG sites to ensure compliance with land grant conditions and make any necessary adjustments as required. So, Secretary and Directors, do you have anything that you want to supplement that we haven't heard so far in the hearing? This is about the way forward. Of course, you don't have to repeat anything that you have already said, and you have said it all. But if there's any omission, you have any big plans that you wish to share with us, by all means, let us know. There's nothing to add from me. Alan, I have no further question. If there's nothing more, I think that should be the end. 5.2, Secretary, 5.2, E, transparency, price transparency, and the introduction of package charge. Well, we said during the past meetings that even if the beds are at no charge, people may still not want to use them because there are other doctors' fees involved. Have you reflected upon this? In E, there are a lot of things there, but no doctors' fees are mentioned in E. Why is the utilization rate so low, even though it's just low charge or free? It's as low as 17%. But as a requirement, we can only impose package charge on new hospitals. So package charge will include doctor's fees, right? Correct. So I just want to put it down so as to make it very clear. Mr. Leung, the Director of Audit sets out his recommendations in 2 pages. I would like to let the secretaries and the directors to respond to the recommendations, which in their view that cannot be fulfilled or comply with in the short term or not at all forever and ever. Can you say something about the recommendations in the recommendations section? If you agree, then there's no need to tell me. But what if there are others which you think will be difficult to comply with in the near term, or you are not going to ever comply with them? I need some time to go over those recommendations. All right? Maybe you can ask another question first. I would like to give some overall personal observations. During the 2 to 3 hearings, I mentioned that the departments very often would rely on the independent auditors of hospitals for financial reporting. In monitoring DEF on the lease conditions, professional doctors of the Department of Health might not be able to conduct any investigation or to conduct some processes which only an auditor can carry out. So I want to make 3 important points. I want to make certain recommendations. The auditor's report, auditor's certificate, please make it more specific as to what would be required. And also the departments in making inspections should arrange to have 1 or 2 meetings with the auditor and raise questions with the auditor. And then thirdly, for the medium and longer term, I would like to propose that you should consider the appropriate design for the financial reports and statements compiled by private hospitals. Well, I thank the member for his suggestions. As for the difficult recommendations, as I have said, we need to take follow-up action for so many matters. One of them that will require more time is the accumulated surpluses over the years and the transfer of the surpluses during the years, and we will have to find our way to deal with these matters. Can we be given a rough timetable? Can you estimate how much time you need to look at these surpluses and where they have gone in a matter of months or years? Well, I already mentioned the time frame. I have a question about paragraph 5.2, A to H, and in particular E. Where can I find doctor's fees covered? Diagnostic procedure of therapeutic services procedures. The package charge will cover all these. Or the hospitals might think that what I want to cover is not covered. For diagnostic procedures and therapeutic services procedures. So diagnostic procedures and therapeutic treatment procedures. What about surgery? Well, treatment is a wide term. Medication, physical therapy, and so on and so forth. All right, thank you for your clarification. Any other questions? Mr. Paul Chair, Well, this may not be entirely within this the ambit of this exercise. So I have this question for the Department of Health. The lack of monitoring of hospital size, is it specific to hospitals? But what about schools? Are we going to expect similar problems? I don't think they can answer this question. It may be the subject of the next auditing exercise. Okay, this report is just about hospitals. Well, I just want to give him a minute to give us advance notification. Well, if we are given a new report, we have to read the report from cover to cover anyway. All right, if there's no further question, I'd like to thank the two secretaries, the directors, and the other attendees. If we have further questions, we would supplement in writing. For those answers which you will provide written replies, please do so as soon as you can.